Well, we were studying fatty acids and, in general, dietary supplements and their effect on a variety of carcinomas. And we decided to look at polyunsaturated and saturated fatty acids, particularly on breast cancer and pancreatic cancer. And we stumbled upon gamma-linolenic acid, oleic acid, and alpha-linolenic acid, which had a higher effect on both breast cancer, and particularly gamma-linolenic acid had a higher effect on pancreatic cancer. So we decided to use gamma-linolenic acid in a concentration or a dose-dependent manner and treat a variety of pancreatic cancer cells to determine whether a particular dose is better to inhibit these cells, and also to determine whether there is a particular type of pancreatic cancer that is inhibited by gamma-linolenic acid. And we found that indeed there is a restricted pancreatic cancer type that is inhibited by gamma-linolenic acid. Gamma-linolenic acid inhibited the growth of pancreatic cancer cells and also induced cell death, which means that gamma-linolenic acid was able not only to stop pancreatic cancer from growing, but also induced death of these cells. One of the conditions of cancer in general is the development of resistance to drugs. And that is a very important and delicate issue because there is no avoidable resistance. And we need to determine really how can we avoid or restrict resistance to drugs. So one of the steps that we perceived was that we need to combine gamma-linolenic acid with other drugs, and we decided to combine gamma-linolenic acid with gemcitabine. Gemcitabine is a chemotherapeutic drug that is currently used for the treatment of pancreatic cancers. When we tested the combination of gamma-linolenic acid and gemcitabine, we found that these drugs work synergistically, and the dose of the chemotherapeutic agent that we need to use is very low, much lower than the dose currently used in the clinic. The next step in our studies are to first determine whether gamma-linolenic acid and gemcitabine are safe for use in humans by developing a phase 1 clinical trial. There is a fundamental need for new therapies for pancreatic cancer patients. There is actually no long-term survival to this disease, and the reason is that we can detect it earlier, and there are no new treatments. Perhaps we can go back to the old treatment, the old medicines and the folkloric medicines such as fatty acids, and use those.